What are the empirical experiment designs and strategies to find the NCC? So this is a abstract kind of table that is basically addressing this question. It's a table from Chris Frith's 1999 Trends in Cognitive Science paper. And this table shows the experimental paradigms for studying the neural correlates of consciousness in normal states first. And then the table 2 is about the abnormal states. And each of the rows shows potential experiments, and each of the column is about perception or memory or action. First row is about subject experience changes while stimulation and our behavior remains constant. So this is a case where fixing one and then varying the two, and then let's see what it means. So the first one is about perception on the neural correlates of binocular rivalry. The binocular rivalry is illusion where you show two stable stimulus to the left eye and the right eye, while you see the switch of the perception between the two. The stimulus itself remains the same, so neural correlates of the stimulus remains the same, but your consciousness definitely changes. And then your motor behavior may or may not be constant. Right? If you don't report, then it stays the same. But if you report, then it can vary with the person. That's the idea. Next, memory. So neural correlates of the episodic recall. So here, stimulation can be the same. Let's say, you give, 1 or 2 or 3 or something like some kind of cue. However, your subjective experience can change depending on the previous memory. So if you are trained or you are asked to remember some particular episode, depending on seeing particular number, then you recall different things. So the conscious memory will be different while the stimulus remains the same. And then action-wise, neural correlates of the awareness of intention. So something like you do exactly the same kind of behavior, like pressing a button, but you may pay attention to when your intention to move or pressing the button starts to appear. And then here, the stimulus itself can be, a clock, which you just passively view, and then you press a button at exactly the same time in 2 trials. But in one trial, you pay attention to, oh, yes, now I want to press a button. And in other trials, you just, completely flat and then just press without any thinking. So that will subtract between this, neural correlates of awareness of intention or not. And then this can be done for other types. Like here, stimulation itself can change, but the subjective experience remains constant. And in the case of the perception, that is, for example, many kind of non-conscious stimulation paradigm is exactly like this. The last week we looked at Stanley Haynes, Nature Neuroscience paper, where in some trials there was a stimulus word, masked word, and another trial there was a masked nothing. So in terms of stimulus, there is a change, but subjective experience-wise, it was constant that seeing nothing in terms of flow of this serial visual presentation. Yeah, it's always masks that you see, but you don't differentiate between seeing the masked word versus masked nothing, and that changes the neural correlates of the stimulus, but neural correlates of consciousness remains the same. Okay. Next, memory. Same kind of thing, like in their paper, also they looked at the memory side of the thing, right? So there, at the time of the recall, you may be shown the things that you don't recognize, but your brain, some parts of the brain may be able to actually remember that you actually saw that stimuli. So that would constitute the same stimuli again, but consciousness remains a different stimulus, but consciousness remains the same, not recognizing it. And in terms of action, neural correlates will stimulate eliciting action without awareness. So that's like a priming experiment. So in the Haynes paradigm, they showed the unconscious stimuli, and then that resulted in the difference in the reaction time for the button press. And there again, the consciousness wise, it's the same. You didn't see it, but behavioral response itself is different. So action is different, and where in the brain that this difference is coming from. That's a question. All right, then the last one, behavior changes, and then subjective experience remains constant. So here, output side remains the same. So for example, correct guessing without awareness, that's basically similar kind of idea as above, so I'll skip. And then implicit learning here is, through the training, you become better at something, like pressing the button in certain order, or playing the piano and so on. But your conscious experience may not change at all. So before and after this learning, what is changing can isolate what is not related to consciousness. And then neural correlates of implicit motor behavior, that's more or less the same as the last one, so I'll skip. So now we can also consider something like this for the abnormal states. For example, hallucination, like here, subjective experience changes without changing the stimulus. So the same stimulus itself is changed same, but some people who hallucinates, may see face or something like that. And the memory is about confabulation. Action-wise, it's abnormal intention. So you are making some kind of behavior exactly the same way, like moving the hands, but in some case you feel like subjectively that you moved it, but sometimes you may feel like somebody else actually moved it. So what's the difference? And then stimulation changes, subjective experience remains constant. So that would be like a blind field in the blind side. We have done the, examined it quite a bit. So while the stimulus becomes, lower contrast to higher contrast, stimulation changes, and then subjects themselves continue to say that, no, I'm not seeing anything. But their behavior starts to become better at the higher contrast in some cases, right? So that's a blind field, a blind side experiment. And then neural correlates of unrecognized items in amnesia. That's basically the same idea, but in the memory domain. But you can study that in the amnesic patients as well. So here, stimulus is, let's say, your most important person in your life, like your partner and so on. But then, because they are amnesic, they say that, no, I don't understand this person or whatever. But compared to that kind of particular person, if this amnesic patient is shown with a different person face, like completely unknown face, then my body may not react at all. But if I see my family's face, even though I say that I don't recognize this and I don't know what it is, and so in terms of subjective experience, it's the same. But bodily reaction might tell you that, oh, this is the important person. So this also isolates some kind of a non-conscious processing in the brain, which is different from neural correlates of consciousness. And then action-wise, neural correlates of stimuli eliciting unintended actions. I'll skip. And then finally, final row is the behavioral changes that accompanies with constant subjective experience. And in terms of perception, neural correlates of correct reaching from agnosia. So here, they reach the object, but not really recognizing it, and in a different way. Memory implicit learning, like the one that I explained in the last slide, but now studied in amnesia. And then finally, neural correlates of unintended actions in some particular patient population. So the idea is that same kind of neural correlates of consciousness studies developed in normal subjects can be translated in patient population or vice versa. So in summary, searching for the NCC is an empirical research program that has made a huge advance since 1990s. And there are many empirical approaches already, and some of which are great inspiration for further research.